Minimally invasive dentistry really can't be done without magnification. You need that magnification, enlargement of the teeth to work to be able to see properly and see what you're doing. What we used in our office, we started about 5 years ago, is we bought a microscope. It's a dental microscope. It's what they would use in surgery and heart surgery and different procedures where you want to be very precise and very meticulous. Endodontists, dentists that do root canals, have used that for many years now. In fact, in the dental schools, when you're going into a residency program for endodontics or root canal specialists, that's part of the program to use magnification and learn how to use a microscope. But now what we've done is we use a microscope doing our everyday dentistry all day long. We use it basically so we can prevent root canals. And so with microscope you can do preventative dentistry. You can see those small grooves and cracks in the teeth. When you're doing a filling, you can inspect it closely on the magnification. Look for cracks, because we know that cracks will eventually lead to tooth fracture and tooth failure. So if we can get those cracks early and remove them, then we can save teeth that way. And so when we see a crack, we don't just leave it. We don't just cover it up with a crown or whatever dentists have done in the past. And usually dentists say, "Oh, you've got cracked tooth syndrome." What does that really mean? Well, it just means that they think there's a crack in your tooth, but they've never really looked at it or seen it. They're just kind of guessing. And so they're just going to go ahead and crown that tooth and hoping that that will work, and maybe 50% of the time that will help. But now what we can do is we can actually inspect the crack, remove the crack, and then onlay it appropriately and get rid of all the pain and sensitivity that the patient's been having. Usually the patient will come in with a sensitive tooth. They'll say it's cold to sweets. Sometimes when I bite on something it really hurts. And those are the teeth that we can fix. And what we do then is we remove the old filling, inspect the tooth, remove the cracks, onlay any weak tooth structure that needs to be onlayed, and then seal it with our immediate dental sealing, and then that tooth is safe, and we can then come back and put our onlay on. And then if we check the occlusion well and the bite and look for any interferences that might have caused that crack or be attributing factors to that, we can deal with those also.